Well, welcome to Discussions again. Sorry, I might be about a week and a half behind, but been busy. But to be honest with you, just haven't had a whole lot to talk about or really to share. Just school's busy. I know I'm not saying nothing that no one doesn't know about because we're all going through it together here. So, people who may not know me in nursing school right now, with about, I think we got a count of 26 or 28 people. I want to say maybe 26, but so far so good. Second half here, we're all doing well. We got about probably got about 5 weeks left in class. 1, 2, 3, 4, 5, 6. I got a calendar in front of me. I'm counting about 6 weeks, 5 weeks left. And then we're going to have a break in December. So we just had our first modular test on our second half here. Don't know how everybody did. To be honest with you, I probably made it by a point and a half ahead on it. Don't like being there. I call it being on the edge. And it was just a real hard one to get motivated to study by. And but I'm going to eat those words because this coming up, Modular 2 test we're going to be getting ready. We're going to be starting with electrolytes. That's going to be a booger right there. A lot of numbers, a lot of knowledge, a lot of, you got to just know high levels, low levels, symptoms, what causes these symptoms, how to correct the symptoms. We have pain management. Hadn't had a chance to look at that one yet to see what that's all about. I'm assuming it's about pain managing, but I'm sure there's going to be more involved in it. And skin integrity and wound care, which I can see that being a very important one. A lot of bedbound people that we have to deal with today, people living longer, and skin breaks down as we get older there. But with that, we're still making it. We're still making it. Still doing clinicals. Trying to find my stride personally in that on those care plans. But going to get there. Had a chance to sit back, reevaluate, and going to try to make an attempt probably to get all 3 satisfactories on one of them. That's my goal for this week. I want to try to set some goals. 3 I think is what we need. Don't quote me on that because I don't know. So I'm going to try my best on that. So with all that being said, I'm just telling things that y'all know already. It took me a while to think about what to share with you there. And a lot of y'all know I work EMS on the weekends. I do on 36-hour shifts, get my paycheck and go home. And so I had an opportunity this past weekend to have been working back at my old county that I started with part-time back in 2012. It's a rural county. You got to know your stuff because a lot of times you're out there by yourself. You're a long way from a hospital, and you may not have a lot of help from volunteers if you need some more hands on scene. But with all that being said, I learned a lot, and it helped me grow. That place helped me grow to be the paramedic of critical thinking. When I say that, I am not the brightest crayon in the box. There are people much smarter with much knowledge that can just do things a lot better as a medic. We all have our strengths and weakness, but that's not what I'm here to talk about. But any job you do, there's always going to be somebody smarter than you, and there's going to be someone always dumber than you. And so I just try to stay in the middle and just ever learning. So we had a good call. And I knew there was going to be a chance of us getting called out in the middle of the night. We had this one section of the county that they do these big four-wheeler ATV trails. This place is over 3,000 acres and over 300 miles of trail out in the woods. So, and I tell you, they bring the people in. And I mean, they bring them in. They got campsites. They really done a real nice job. They hold concerts out there. But we were told that they were going to have a midnight ride. And when that happens, 10 times out of 10, you will get called out there because there's a lot of drinking involved. People riding on those trails in the dark. Now, they got lights on these ATVs, but still, something's going to happen. Well, it happened. And what happened was someone rolled their ATV, had a broken ankle. They had actually a compound fracture. They had the bone sticking out. And but with that being said, this fellow was not lacking any experience on scene. At this time, well, we're shorthanded, like all EMS services are shorthanded, but we had an extra person. He didn't have a partner, so he was on a first responding truck. So when we got the call, my partner and I, we responded, and we had a pretty good response time, heading out that way because it was in our area. And he took off ahead of us. And so when he got there, we're communicating on the radio. And he got there way ahead of us. The not the owner, but the staff there, they had their own side-by-side. He grabbed his, this first responder grabbed his bag, hopped in, he's a paramedic, got his gear. They drove him out there to make patient contact. And then when we showed up, rescue squad was already there. They had their side-by-side, and they're set up to have a Stokes slitter in the back. You can put them on, it's made to carry the patients in and out. So with all that being said, we loaded up and we drove out there. So we got there. A lot of hands was on board. So this fellow here, things are going well. He had first aid handed to him already. He was packaged up, ankle wrapped up, and he had a pretty good break on his ankle there. I've seen worse, but still, when you have a bone sticking out of your skin, it's still bad and it hurts. We had our pain meds. We administered some medication to him. We loaded him up, got him back to our truck. Did a little bit of stabilization, got some IVs started, and took him to the trauma center. So, with all that being said, what's the point I'm trying to make with this here? So, made me starting to think, with this being said, is with many years of just of experience that I've have doing calls like this, and worked a lot of trauma, worked a lot of medical, and with that comes with a lot of studying. And there's a lot of follow-up studying. Sometimes calls don't go your way. Sometimes you do things and things don't work. Or you see things, you come across something, and sometimes what you are doing doesn't work. It's not your fault, but the body is a mysterious thing, and it may not respond to certain medications that it needs to respond to. So that means you're ever studying. You're always with your head in the books there. So when we get through this class and we're going through these certain sections that we're going through, maybe start to think of all the times when we get tired and we get bogged down, we get frustrated for just not being at home, trying to make a paycheck, trying to get hours to work, trying to balance yourself, your family, your health. You know what I'm talking about. So maybe start to think, why do we study? So when we're going through times like this and you're feeling like this, feeling frustrated, feeling like nothing is coming together, you just got to keep studying. Because the more you keep your head in the books, the more you get with your, a couple of podcasts, I'll talk about finding your tribe. You get with your tribe. You share. You lift each other up. But you got to study. Because that day is going to come where that studying is going to pay off. It's going to pay off where, each to every one of us is going to be doing different things as nurses. Some may go on to get their RN, some may stay as a LPN, and that's fine and dandy. Whatever you feel called to do, you do it. But study in your field. Why do we study? We study to gain knowledge. Knowledge is very powerful, especially in the medical field. Medical is always ever changing. It's always ever changing there. So you need to keep studying for that, because that studying, when you gain knowledge, you're going to apply that knowledge to a critical situation one day. And it will also help you to acquire critical thinking skills. And so you may not see it now. We all are learning the basics right now. And so with learning these basics here, then you're going to grow. I always say we're putting meat on the bones. We're getting muscle. Each little time we take a test or we do things, we're adding more and more to this, building our knowledge, as nurses, that we can use these skills and these talents one day to better someone else's life. And so you got to get that critical thinking skills on. And these are things I know we know, but we're coming to a point now where this critical thinking is going to be very critical. These tests are getting harder. These questions are building on top of each other. Now we're going to have to start pulling knowledge from things we learned last month. What's going to happen January, February, March, and April, then we got to start remembering things that were learned back in August, back in September, back in October. So you're ever studying. Never forget, you always got to be studying if you're going to be in the medical field. There's always things to be learned there. We got to make our critical thinking skills sharp. And with that also being said, you're going to improve your communication skills. We talked about that. We talked about doing patient care, pass downs. I know I'm not saying what it is technically what the book says. I call it a pass down or a handoff. You got to give that situation good. I love, there are times where at another service I work for part-time, I have to do transports, critical care transports from one hospital to the next, because there's one hospital here, it's a small one. It's a good hospital, but they can't handle trauma. They can't handle cardiac calls. They can't handle strokes. And so with all that being said, I feel now, what I'm learning now in school, I'm starting to apply it as a paramedic when I walk in there and I get that packet. I get that patient packet. And I open it up, and now I'm finding my questionings to broaden. I'm trying to broaden my communication skills on asking questions about more about this patient. Sometimes it's trauma for me. Sometimes they're having a heart attack. Sometimes they got them knocked down. And when I said knocked down, the patient has been, they have paralyzed him where he's not breathing, where he is intubated, and he's on a vent. And I got to monitor that vent while getting him to the hospital. Well, with that being done, you just don't talk to a nurse. You got to talk to respiratory therapy. And so you got to get the paperwork from them. You got to see what the settings on that machine is. Communication skills. You got to be a good communicator if you're ever going to be doing that. And you might be in that position one day. You might be that nurse in that ER that you got to give that paramedic a good pass down. We always love having a good pass down, not just they need to be gone right now, see you later. You got to be a good communicator when you are in this health field that you are getting involved in right there. And the last thing, then we're going to call it a night here, is that what do we also study? Is that we study to practice effective time management. So, like I said, some of us are going to be in different types of fields. You may be in a type of healthcare where time management is very, very important. I think of, this is what I know, I think of, what about a trauma nurse? Time management, good patient assessment. What do I need to do first? What do I need to do second? What do I need to do first that I need to do later because something else is more important to take care of, but then I got to backtrack and take care of the first thing that I was looking at. So time management is why we study. When you learn these processes, when you learn these skills, when you learn these diseases and how to manage, you learn these lab values. Lab values are so important. To me, it's another language. It's a whole other language, and we're going to be getting into that here real soon. And believe me, I don't know a whole lot. I have a little bit, but nothing what I have reviewed I don't. And so a lot of times in those packets we get lab values, and I look, and we do have medications that can maybe help someone who may be their labs may be low, and I may ask permission. Well, can I push this med to get this lab up? I got to get this lab value up. That's all up to the physician here if he wants me to, but it's being that effectiveness in your time managing when you're working with these patients right here. And so with that being said, I know that being tired and just frustrated, but just remember, you ask yourself, why am I studying? What's my goal? What I need to do. And just remember, you're studying to better yourself. You're studying to better because you may be that blessing to that patient down the road with what you've learned. So with that being said, y'all have a good evening. I'm going to be posting this up here soon, and I will be seeing you tomorrow morning in school, and we're going to knock this electrolytes out, and we're going to do a good job. So with that being said, y'all have a good evening.